Hello, everyone. My name is Chloe Edwards with Voices for Virginia's Children. I am our Advocacy and Engagement Manager, and today I'm pleased to bring to you our Black History Month Community Chat series. It's titled, What's Right with Us? Creating Black History. This Black History Month is especially timely. Today, we face a modern civil rights movement and a nationwide pandemic that has called attention to racism as a public health crisis and further exposed racial and ethnic disparities. In 2007, the Commonwealth of Virginia formally apologized for American slavery. Just 2 years ago, Virginia acknowledged the 400th year anniversary of the arrival of the first enslaved Africans to Old Point Comfort, now Fort Monroe in Hampton, Virginia. While the cultural, racial, and historical traumas of the Black community are often referenced today negatively, we don't want to talk about what's wrong with us, what's happened to us, but instead, what's right with us. For centuries, we have overcome the circumstances that have oppressed us and played a transformative role in the transformation of institutions that interact with our communities. For example, Maya Angelou's poem, Still I Rise, is a message of liberation and survival. It was a consistent theme in all of Maya Angelou's work. After it was published in 1978, the poem continues to reach readers and audiences, and it cuts across racial lines and national boundaries. So we'll playage on that theme today. I'm pleased to introduce you to Michael Royster. I'll let make sure Michael Royster can kind of elaborate on his background, but he is the Vice President of the Institute for Public Health Innovation. He has established the Institute's Richmond office and is expanding and developing initiatives to support public health priorities across Virginia. He provides expertise and oversight for an extensive portfolio of programs, including community health workforce development, health and all policies, healthy eating and active living policies, and community health improvement planning. Michael Royster is a doctor and also holds a master's of public health degree. He is also a fellow of the American College of Preventive Medicine. And if there's anything else you'd like to elaborate on, I want to make sure I don't mess it up in explaining all of your achievements. Please feel free to do so. But thank you for joining us today.
Thanks, Chloe. I'm happy to be with you today.
Thank you for joining us once again. So let's start off with all of those achievements I was talking about. Tell us a little about yourself and what's led you to this moment in history today. And certainly if you'd like to elaborate on your professional background, I definitely want to give you an opportunity to do so that younger folks can really see themselves represented through your work.
Mm-hmm. Yeah, sure, Chloe. As you mentioned, I'm Senior Vice President of the Institute for Public Health Innovation, which is a nonprofit public health institute that serves Virginia as well as Maryland and DC. And I'm based in the Richmond area, work across Virginia as well as in Virginia, DC and Maryland also. As you described, we're involved in a number of different aspects of work around promoting public health and health equity. I think one of the other areas that we've really developed some focus on recently is around training and technical assistance for organizations and coalitions as they explore their efforts to more intentionally promote health equity and racial justice in their work. I've been with IPHI for about 8 years now. Prior to that, I was worked for the Virginia Department of Health as the Director of the Office of Minority Health and Health Equity, which is also the State Office of Rural Health and the State Primary Care Office. Prior to that, I was a local health director in Virginia as well, serving in the Crater Health District based in Petersburg and working across 8 localities in Southside Virginia to help promote health and health equity. As you mentioned, I am a physician with public health training, and really my whole career has been focused on promoting health and advancing health equity, and really trying to create or help communities create the opportunities to be healthy, to have access to healthy food, healthcare, safe places to be physically active, jobs, housing, all those things that help people to be healthy. And so that's really been the focus of my work. Um, I would say that what really led me to this path is um, the influence of my parents, probably for the most part. My dad is a retired education administrator who was always very active in the NAACP, as well as his fraternity, Kappa Alpha Psi, and his both professional and I guess personal involvements have always been around racial justice and advocating for Black communities. My mom is a retired school social worker who throughout her career really spent her time working with and supporting families that were facing socioeconomic and racial challenges and other barriers to their kids having a quality successful education. And so from them I think I really just was influenced in terms of thinking about issues from the standpoint of racial equity, from being committed to education and wanting to be involved in helping to create opportunities for others to be healthy and to thrive. So that's a little bit about me. Yeah.
Thank you. And that really goes into our second question. I sat in a workshop one time and the presenter kind of described what brings us to our destiny. Is it purpose? Is it pain? Is it passion? Or is it opportunity? And you definitely delved into some of those themes. But if you had to think of a moment or an impact or an adversity that really shaped the outcome of your destiny today, hone in on that moment and tell me what leads you to the work that you do today.
Hmm. Yeah. I would say if there was a moment that really I come back to today even, and it I think had to do with being a young child growing up in a suburban community. My parents, thought it would be really important for us uh, to grow up in a neighborhood that had the opportunities for us to attend quality school, things like that. And so that uh, you know not surprisingly led us to growing up in a predominantly white community. And I remember when I was about 5 years old, my brother and I were out playing in the neighborhood with other kids who were all white. And my brother got into a little argument, a kind of innocent little argument with one of the other kids. And that kid, who was probably around 6 or 7 years old, turned to him and, called him the N-word and told him to go back to Africa. And from that point on, it kind of, woke me up, woke my brother up, and really was the first example of where, despite, theoretically being in a community that gave us great opportunities, we were still looked at differently and would be treated differently. And that's really been, experienced through many aspects of my life growing up, certainly in school, in college, medical school even, experienced personally, as well as seeing other Black people of color being treated differently and really in an unfair manner. So that's, I think, been really a defining point in my life. And fortunately, my parents, really raised us to be proud of being Black and to try to connect us with cultural experiences and opportunities to reinforce the strengths of the Black community. And their work, reinforced the importance of being an advocate for racial justice. So I think all of that combined really helped to shape my view of the world and the work that I do and the commitment that I have really towards health equity and racial equity as well.
Really a powerful story, turning that tribulation into a triumph. When you think of what kept you motivated past that moment, do you have a hero that keeps you motivated? If so, who is it? I know you've mentioned your parents, but
Mm-hmm.
is there any other icons that you really look up to?
Yeah, I would say one of the first people that comes to my mind is my maternal grandmother, who passed away when I was 14, but she was always had a very strong role in my life. She and my mother from Wilmington, North Carolina, and my grandmother was the first Black member of the school board in Wilmington after Reconstruction. And I saw in her that leadership, that commitment to the community and to making a difference. My mother would often tell me the story that when she was young growing up, my grandmother, who was a teacher at the time in segregated Wilmington, North Carolina, in the segregated schools, had gone to the school board, which of course at that time was all white, and made a suggestion that they have an honor roll for the Black students in the Black schools. And at the time they had an honor roll in the white schools, but they didn't have one in the Black schools. And the school board was apparently so offended by her suggestion that she was threatened with being fired from her job unless she, backed down from that suggestion that she had. And so because she was a single mother with two young kids, she had no choice but to back down to maintain her livelihood, to raise her kids. But again, years later, when I was a little kid, she eventually was on that school board and helped to shape policy to the benefit of Black kids in the school system there. So that's I think she always served as a hero in that respect. Um, I think I would say in terms of modern day, I think there are people that inspire me to kind of keep going forward. From a spiritual perspective, the Buddha is a great inspiration for me. In terms of other aspects, I would say that I'm very inspired by the music of Bob Marley. Nelson Mandela is a great inspiration. Angela Davis's writings and President Obama have all been, I think, folks that have kind of I've observed and learned from and been motivated and inspired by.
Awesome. It sounds like you had a lot of good trouble that runs in your family. I have
Definitely.
Angela Davis and Barack and Michelle. You all can't see it in my because of my virtual background, but they're on my wall too. They inspire me as well.
Uh-huh. Great.
So you mentioned some examples of modern day history, but I'm interested to hear how you in particular are contributing to Black history. Is there something historical that you have achieved, whether it's in your family or in the community, or are there any, I know you're working on a racism as a public health crisis work, which would be historical, but are there anything, any kinds of history in the making that you're working
Hmm.
towards?
Yeah, that's a good question. It's hard for me to think of myself as a history maker. So I guess I just kind of hope that I can help contribute to creating a better world, as they say, to leave the world better than it was when I got here, and how it has been during my lifetime. Um, so I don't know if that's history making or not. I guess I'll say that a lot of the work that I do and our organization does and I've done with communities is really focused on trying to ensure that everybody has the opportunity to be healthy. Um, and that involves a lot of work engaging communities directly and really trying to draw attention to community voices to shape and guide the work that we do, and to also be involved in the policy realm to try to hopefully take those perspectives and those priorities in a way that can help people use their voice, as well as to help with my experience around the policy realm to help make changes that can really have sustained impact on people's health and quality of life. But again, that's done in collaboration with other people, other communities, And so maybe together we're all making Black history.
I was going to echo those sentiments. I think, especially with now us being in a modern civil rights movement, the same March on Washington happening in 2020, we're all contributing to history today in some
Hmm.
sort of way, shape, or form. But should the racism as a public health crisis resolution pass, Virginia would be in the first state in the South to explicitly recognize
Yeah.
and name racism as a public health crisis. So that's just one example of the work that you are currently contributing to.
Yeah, well, definitely with your leadership on that, it's and of course Delegate Aird as well. But yeah, I'm excited to be a part of that.
And for you to really be thinking of all the biases that contribute to public health, for you to be a Black doctor and work for a health department, etc.
Hmm.
I really wanted to elaborate on your achievements because it's important for the younger generation to see what is possible for them too. So that
Hmm.
kind of brings me to the next question. We often depict minority communities or marginalized communities in kind of a negative light, although I certainly think it's important to recognize the tribulations. I also think it's just as important to recognize the triumphs. So tell us what's right with you, what characteristics and hard work led to the achievements that you've accomplished today.
Hmm. Well, I think first I'd say that where I am today definitely is a product of the influence of many other people. Most obviously, my parents, my grandmother, and other family members, um, and then other people that I've interacted with and who've supported me in the work that I do. Um, so I guess I would say that. That those experiences have reinforced to me and really been and seen a commitment to education that my parents really instilled in me and my family, as well as just the cultivating an interest in ongoing growth and development, for myself and for people around me. And then also a strong work ethic that I learned from my parents that has helped me along. And certainly I'd also have to say that my family, my wife and 3 kids, are really, critical to who I am. I definitely, really identify not only as a Black man, but as a husband and a father, and, take all of that very seriously. And one of the things that I've certainly tried to be very intentional about is to prioritizing family, and and being with and helping to raise and help my kids to grow and to develop, both to be successful in their own right as well as to contribute to creating a better world for everyone, through the work that they do. So yeah, I think those are just some of the things that come to mind there.
Awesome. Well, you talked about fatherhood and certainly going across some of the combating some of the stigmas about fatherhood that we witness today in mainstream society.
Hmm.
But the phrase "when you see what you can become," I've repeated that a few times throughout this community chat, really resonates with me and is often repeated. It's been used to describe younger generations of Black children who see what is possible through you, your achievements, your work. What advice can you give the younger generation, whether it's thinking about your children and the kind of life you hope they lead or contribute to, or just other generations of young people that we're currently paving the way for?
Hmm.
What kind of advice could you give them, or what kind of sentiments can help them overcome some of the obstacles that you have overcome?
Hmm. I think maybe I can start with what I tell my kids. I really reinforce to them to make the most out of the opportunities they have. They've grown up in with a lot of opportunities that others may not have, and I think it's both important that they recognize that and that they really are serious about making the most out of that. And then at the same time, that they, again, recognize that not everyone has those same opportunities, and that part of the important roles that they can play are to help draw attention to those issues and to address them through the influences that they may have, or ultimately the power that they have in their within themselves to not only achieve individually, but to collectively help us all to achieve. Um, and yeah, I guess more broadly, I would encourage younger generations to again uh, really focus on their education, to focus on the importance of family, to find social networks and connections that are so important for all of us to be healthy and to be successful, um, and to keep moving forward, despite the challenges that we face, still continue to move forward, and to define for yourself what your life will be, what you want it to be, and then make the effort to go in that direction. One of the other things that comes to mind is really seek out mentors, finding people who've been through similar things or have insights from their life experience can be really critical to navigating challenges, to taking advantage of opportunities that may present themselves, or even being aware of how to approach different situations and to hopefully be successful.
Yeah, I've seen these narratives in the past that shame the older generations, and also similar narratives that shame the millennial or Generation Z. But I really like to connect the dots and recognize that the path that was created for us, and then a piece of the path that we're altering to create a larger path for the future generations. There was an elder chat that I interviewed my grandmother for, and she talked about Jim Crow and how she wanted to get ice cream from a shop, but it was whites only. And
Mhm.
she said, perhaps if I was more like your generation, I wouldn't have purchased the ice cream in the first place. And that really stuck with me because, yes, they did combat Jim Crow and all of that, but she also recognized kind of the sassiness of our generation and how we
Mhm.
wouldn't have even walked in the shop. So what makes you proud of Black millennials and Generation Z, as someone from an elder from a different generation?
Oh, I guess I've
And
officially been,
just
I've
to
officially,
clarify, elder is not always age, but also just a status that folks
yeah.
reach.
Yeah, well, no, thanks. I hadn't officially reached the elder designation yet until you gave me that, so I appreciate it. Um, yeah, well, I guess for younger generations, I mean, kind of building on what you were saying, I am very inspired, really, to see the activism of younger folks who, especially with the times that we're in, have really come out to, say that what we're seeing today isn't acceptable, and developing and leading new initiatives and new ways of addressing these issues of racial injustice. Um, yeah, I mean, I think the model of say the civil rights movement, which was a critical part of our history, doesn't necessarily apply the same today with social media, with more opportunities for women to be in leadership roles, et cetera. And so, what we've seen with Black Lives Matter and with other efforts, have really, to my, in my perspective, come up with a different way of addressing these issues that is really timely for where we are now, and has been obviously very effective. And yeah, so I mean, I encourage younger generations doing what you all are doing to challenge us to not get complacent, because at the stage that I'm in and many others, we can get distracted with family and jobs and bills and all of those things. But those, if we're not, I think all of us across generations still involved in, advocating for justice and equity, then we're not going to be able to be successful. And so, I look to the younger generations to, really take that leadership role as you all are doing and continue to guide us forward.
Thank you. So while Black culture is resilient, overcoming 400 years of slavery is not easy. I know you've sent a sentiment to the younger generation, or you've elaborated on that, but if you could talk to your younger self, that child pursuing the journey to medical school and equity and public health and justice, what piece of advice could you give to your younger self or others trying to pursue this precise field?
Mm-hmm. I would say that for my younger self, I would probably encourage my younger self to be more active and vocal. I grew up very shy, so that was difficult in and of itself, but it was also during a time period where, and still some today, but even more so then, that a lot of people didn't or wouldn't talk about issues of racism and health inequities. Those were things that you didn't discuss, and yet, despite my life experiences of what I was seeing in my daily interactions and what my family was seeing, and what our broader community was seeing, I think there was hesitancy, and certainly I had hesitancy in terms of being as vocal and direct around, in particular, say, racism, when I was in, certainly as a younger person, but even in college and medical school, and seeing how people were treated differently, patients were treated differently based on race. And I think today, we're at a point where, quite frankly, it's become apparent that things have not really changed from when I was a kid. And it's so blatant now. And again, we have folks really leading the charge to draw attention to and keep these issues on the front burner. So I guess I would say to myself to not be afraid, to seek out other people who can, could have supported kind of my efforts or my concerns, to build that base of like-minded people to help to make change. That's trying to think if there's anything else that necessarily comes to mind. I think that's about it.
It goes back to that theme of good trouble, except now good collective trouble.
Yeah.
That's what we really need. But it's
Exactly.
a shame that it is described as trouble in the first place to make a difference.
And another, I think a thing that comes to mind as a part of that is, especially I think growing up and oftentimes being in settings where I was one of very few people of color, especially African Americans, especially Black men, really, and there's still environments like that. And so I would say that younger folks who are in those situations, I wish I had, really sought out, mentors or others even my age who, I could really have these conversations with, to have that support, to know that, I wasn't experiencing these things alone, and that having other people who can kind of, commiserate and even help strategize can be really, really helpful. So even on just that personal level of being able to, be resilient in the face of individual or interpersonal kinds of, experiences of racism, or within, say, their university or their medical school, for my example. Having people that you can really talk to and have that social support around those challenging issues.
Mhm. I think it's a really tough space to navigate that. One, young people are starting their careers younger and they're really seeking one degree after the other. And so they
Hmm.
find themselves in spaces where they're not only the youngest in the room, but also one of the few people of color in the room. And
Hmm.
that's a very tough space to navigate. But I've
Yeah.
also recognized young people really calling things out in their universities,
Hmm.
strategizing marches, and even in professional settings, calling things out and or naming the issue.
Yeah.
And but I'm sure it is a tough space to navigate. Any advice for navigating that particular space?
Um, yeah, I mean, I think having people to, if you're, for me, not being the only person, but trying to find allies or others who can, together kind of draw attention to the issues. I mean, yeah, as you said, I'm definitely seeing a lot more nowadays where things are being called out more directly than, when I was in school. So I think that's a great change. And I think that's the kind of thing that's really going to be necessary to make change. I think a lot of times I did, a lot of times people want the strategies to be superficial and quick to, address, the whole institutional racism of, university or, healthcare system, or whatever. And it does require being consistent and calling things out, which, again, I think there is more of that today. So I definitely encourage, younger folks in school to really continue to do that. Changing the curriculum
Mhm.
and how it's taught and all of those things are really important to do. And it requires people who, uh, can really see where different content is not representative, or is, creates a, negative story around people of color or other marginalized groups, and, hoping to change that.
Mhm. And with the truth being, we may not see that immediate change in every case, but the change will certainly be witnessed over time,
Hmm.
which takes me back to Dr. Martin Luther King's dream. We had the March on Washington in 1963, where he gave his famous I Have a Dream speech. And on August 28th, 2020, that same march took place again. But times certainly still look different, even though it's not remarkably different, as I'm sure Dr. King hoped for. But I pulled a quote from his speech. I have a dream that my four little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. And so these were one of the infamous quotes taken from that speech. That same march again occurred in 2020. What's your dream for the future of Virginia's children, if you could elaborate on a dream?
Yeah, I guess it would basically be that all children in Virginia grow up in healthy, safe, and supportive families and communities, and that they have the chance to fulfill their potential to be happy and to contribute to society. That would be, I think, the ultimate dream. Unfortunately, we're not there, and there's, a lot of work that I think is necessary for us to get to that point.
Do you see any specific gaps in state or federal investments that would be needed to make that possible? We're certainly working towards some policy investments now, even during the economic crisis. But if you had a wish list, would you identify any investments you feel we should take to make it possible?
Hmm. Yeah, I mean, I think from a public health perspective, I really look at things as, one, what are the true root causes and how is everything interconnected? And, the reality is that, for children to be healthy and to thrive, Um, it involves not only them, but their parents, how their parents grow up, their health and well-being and income that they have to have a healthy pregnancy and to then have a healthy child and then to be able to raise that child. So I think the policies that are necessary for children to thrive are really the policies that help us, from a public health standpoint, to create healthy communities. So things like uh, you know um, universal high quality early childhood care and education, a living wage that allows all people to live outside of the poverty level, funding to balance the inequities in educational funding that are produced along due to racial segregation, and really truly funding and providing the supports that are needed for all children to get a quality education. Housing, access to quality housing for everybody, universal health care, jobs. I think it's a societal perspective. So I think I look at it very broadly, but within that there are specific policies that can help support each of those platforms, so to speak, that ultimately help us to create healthy communities for kids to be born into and to grow up and thrive in.
So not necessarily one key policy solution, but a series of different solutions.
Yeah, and I think just our framework of thinking about it is important. If we look at child well-being from a narrow standpoint, from a as a looking at specific sectors almost as kind of being the solution, we miss the bigger picture of how everything that a child experiences even before they're born is critical to their well-being. And if we had policy at the local level, state level, and federal level that really took that into account and said we want to create communities, support families that so that all kids can thrive, then I think our policy approaches would be much more interconnected and much more realistic in terms of how we would go about doing that. There's other countries that have that we could learn from in terms of how they are committed to children and families in their policies, their public policies, and then their how they prioritize their funding, et cetera. We know that there are ways to really help to ensure that many more kids can grow up with opportunity. So it's a matter of us having that will to do that collectively.
Mhm. Well, we are working on a number of policy solutions. I encourage everyone to visit vakids.org/racial-truth around some of the solutions we're working on around education, family economic security, and supporting as well as housing and healthcare access, early childhood education, and child welfare. And is there a website that individuals can visit to get in touch with Institute for Public Health Innovation?
Yeah, the website is institutephi.org. So you can learn more about the organization, and my contact information is there as well.
Awesome. Is there anything else you would like to add?
Yeah, I would just like to thank you, Chloe, for the work that you're doing and for this segment, as well as the many other things that you're doing as one of those young leaders that is taking the torch, so to speak, and continuing to move us forward for all children, and certainly for children of color as well. So it's the kind of work that you and others do, and Voices as an organization that really is critical to creating ultimately an environment where everyone has the opportunity to live healthy, thriving lives. So thank you for all that you do.
Well, thank you for joining us today and dropping all of those gems for Black History Month. And to get in touch with Voices, you all can visit vakids.org To get in touch with me, I'm Chloe, CHLOE, at vakids.org. And stay tuned for our next Black History Month services series on our website under events. Thanks for joining.